Good afternoon. I'm Joe Pritchett, career counselor at your Salem Community College. Today, we continue our series of roundtable discussions with leaders and influencers in multiple employment fields here in Salem County. This is an opportunity for those doing career exploration, and particularly those who are exploring due to COVID-19 and the fallout from the pandemic, to learn more about various career pathways available to our county's residents. Today, we're going to spend a few minutes discussing options in the medical fields. I'd like to introduce our guests, Nicole Wilson, Director of Inspira Employment Connection, and Teresa Capello, who is the Director of Nursing here at Salem Community College. Thanks to each of you for being with us today. I appreciate the opportunity to talk with you about what is happening in the medical fields and to draw on your expertise. So I'm going to start with Nicole and just ask that you would take a few minutes to introduce yourself, your company, what they do, and just kind of your background, your story, how you got to where you are.
Sure. My name is Nicole Wilson. I work for Inspira Health. We manage employment, hiring, recruiting for the entire organization. So we serve all 5 counties in our service area with staffing. I've been in healthcare for probably, about 23 years. Done recruiting for about 18 of those years. And HR, I'm a people person. I like people. I like variety in recruiting, and I like really finding the right fit. I like finding the right person for the right job at the right time, who meets the values of our organization.
And I get the privilege of working with Teresa, and she was a gift to our college this year. We were without a nursing director, and we were so excited to bring her on. So I want to give you a minute or two to talk about your journey and your knowledge of the nursing fields, Teresa.
Okay, my name is Teresa Capello, and I started in the healthcare business. In 1987, I started as a floor nurse. I went to school at a community college, and while I was a staff nurse, I went back to school and I earned my BSN. After that, I went back to school again and earned my master's, and then after that, I earned my doctorate in nursing practice. That enabled me to go into nursing education. I've been teaching since 2009. I came to Salem Community College in December of 2019, so it's been a couple months. I love my position. There's all kinds of opportunities for both registered nurses and licensed practical nurses, so stay tuned.
All right, thank you. So I want to talk a little bit about the types of jobs and careers one might find in the fields that you work in. And we're going to really have Nicole focus on those roles outside of like doctors and nurses, and more on the support in a medical institution, medical facility. I'm going to give Teresa just a moment to talk a little bit about the kinds of careers that someone might be able to find in the nursing field.
Okay, so for nurses, we have both licensed practical nurses and registered nurses. At Salem Community College, we have both programs. We have an entry-level PN program, which would enable you to sit for the NCLEX to earn your licensed practical nursing degree. With that, PNs can find jobs mostly in long-term care facilities, assisted living facilities, acute rehabilitation centers. There are some hospitals that do hire licensed practical nurses, so there's quite a bit of opportunities. You can also find employment in physicians' offices, outpatient settings, different types of daycares. So there's quite a bit of opportunity out there. New Jersey is facing a very real and very serious healthcare crisis. And it's a trickle-down effect. So with the doctors, there's going to be a shortage of doctors. And what's going to happen, we're going to have registered nurses that are going to advance their careers and go on to become advanced practice nurses. Then there's not going to be enough RNs. With that, there's not going to be enough licensed practical nurses. So we need to start feeding our healthcare system with LPNs so that they can come in and help us get through this crisis. And I think COVID is probably going to aggravate the situation where the nursing shortage is going to be compounded.
I know coming from Colorado, one of the things that we were exploring that last year I was out there was that gap in the nursing field, in that we were graduating about 60 to 70% from our collective programs in the state of the nursing needs we had each year. We weren't close. And so I get that there's a serious need. So how about you, Nicole? You recruit and hire a lot of different positions, I'm sure. Why don't you talk to us a little bit about what it looks like in a facility like yours?
It does. We hire everything from clinical to non-clinical. And, a lot of times people don't think of non-clinical opportunities in a hospital or a healthcare setting. But when you think of it, business needs what a business needs for it to run, right? So it needs all facets of a business model or a business plan. So we hire everything from environmental service workers, food service workers, to accountants, marketers, and then all of your clinical areas, nurse aides and medical assistants and RNs, as we mentioned earlier, along with some of those nurse practitioners that are moving into that provider role within physician offices. And so healthcare really offers you a really wide scope of opportunity, whether you are someone who is clinical or not clinical.
Okay. Is there a role in that medical field right now that you would say is pretty hot, that would be like somebody who's thinking of transitioning to a new career, it might be a good place for them to look?
Obviously, nursing is always one of those areas that's a good place to look, right? Because we're always going to need nurses in some capacity. Specifically for us, our needs are really more in critical care areas, more focused areas. But non-clinically speaking, coders are always a position that we struggle to fill when it's time to fill. Candidates that have a 4-year or a 2-year degree with that acute care experience under their belt is really difficult to come by. It's a challenge to find when those types of positions are open. We have a challenge sometimes even finding those corporate business areas, things like marketing, things like human resources, again, because people don't really equate that with healthcare. And so sometimes we're one of the last places that they look. We're nonprofit, and some people aren't looking to go down that route either. So those areas are areas where really, if we could find business type people, if we could instill that in them from the ground up, really understand what healthcare is and understand what a business person's role is in healthcare, that's really helpful. Things like radiology technicians are always open. Lab is an area that right now is in detriment. There are not enough schools in the area to produce the students that we need to populate the labs in the hospitals. And so that's another area that moving forward and in the future is going to be in dire need of employment.
Okay. Anything you want to add to that, Teresa? Or?
No, I think, Nicole, you brought up many good points. And I think with COVID, we have certainly seen that it's just not nurses and doctors that are essential personnel. Yeah. There's so many people in the healthcare agencies that are so needed and so important. So we do not want to overlook those occupations.
Absolutely. Absolutely. Environmental services, food service. I mean, the people that are taking care of your hospitals day in and day out really have been on the front line alongside of those clinical staff.
Yes. And you know what? COVID was unfortunate, but I'm happy to see that it has shed the light on how essential other employees are in our community as well as in the hospitals. So yeah, we're going to need healthcare workers, all different kinds of healthcare workers.
Exactly.
Especially now. I don't know what the impact COVID will have on, but I would imagine that it's going to have a big impact on healthcare agencies as far as employees.
In your research, or what you're reading these days, Nicole, are you seeing like after September 11th, right, there was a pretty significant spike in the number of people who signed up for the military, who joined police academies, things like that. Are you seeing that kind of a spike in medical fields right now? Or is it too early?
A little bit differently. I think it's a little bit early, but what I think we have seen is an overwhelming response from the community at large, and people who have previously been in the profession, right, and maybe stepped away, to have a desire to want to contribute to assist in this pandemic, and really have stepped forward to partner with organizations and come back into the field that maybe they left, or come back into the field that maybe they haven't had that hands-on in quite some time, and step up and stand next to the other clinicians and work together to bring us to a place that was, a safe point in the pandemic.
I can say we just admitted our both classes for the PM program and the RN program, and we sent out over 100 acceptance letters, and we only had 2 people decline their seats, which we were very surprised to see, for that to happen. So we were happy, but so everybody, we thought some people might not want to go through with the nursing program, but they are, which is good.
That's great.
Good. Yeah. That speaks to the heart of who we are, right?
Mm-hmm.
Yeah. Mm-hmm.
So let's talk about incomes just a little bit. I want to start with that nursing side of things, Teresa, if you don't mind. And the different levels, what could someone expect to make, do you think?
So I'm going to take a guess here from what I've talked to other people in the field, and I'm no longer employed at the hospital, but I would think that entry-level RNs would be between $40 and $45, and then entry-level LPNs might be around $25 to $30 an hour. So that would be their starting point. So it is a significant salary once you finish school. And our investment for a PM program, you're talking a year. We start in the summer and they end in May. So it's not even it's just about a full year of a nursing program to enter into the practical nursing field.
But that's a 2-year program at our school, right?
No, the PN program is 1 year.
No, I mean the start to finish, like the PN and then into RN is just 2 years, right? So it's not like they're going to a 4-year college paying $40,000, $30,000 a year to go make decent money. They can do this after 2 years in a community college.
Well, for the PM program, they can start earning money after 1 year.
Right.
They do not have to go on for their RN, but if they choose to go on to their RN, yes, it's 2 years from start to finish.
Yeah, that's a pretty good pathway.
Yes, it is. It is
hard work, but a good pathway.
It's definitely hard work, but it's worth it. The graduates, and we had a pinning ceremony just recently, and they were thrilled to death. And we're getting our early results for the NCLEX, and so far everyone's passed. Good. So it's looking good. Yeah. Good. All right. Because you have to remember, we went online for the spring starting in March, so they finished up the program online, remote, did all learning remotely, even clinical. We were able to secure a simulation for, it's called vClin, which is a simulation application. So they were actually administering meds with a simulator online, which was awesome. It really it saved us, because I don't know how we would have been able to get them that experience.
Yep.
That's great.
Yeah.
So again, Nicole, you're looking at a variety of positions.
Mm-hmm.
Let's talk a little bit about entry level, and then what possibilities there are for incomes at a higher level at the medical centers.
Yeah, I think, entry level, probably pay would be anywhere between $13 and $20 an hour based on what it is entry level we're talking about, what type of education, what type of position. Mm-hmm. Mid-level type positions are probably going to fall somewhere between $25 an hour and maybe $30 an hour. And then obviously you have your management level, director level, where they could make anywhere between $70,000 and over $100,000 annually with that experience and that education. For us, a lot of the programs for nursing, new grad nurses are starting with no experience at around $30 an hour. LPNs, it depends on the position and it depends on the setting that they're in. But really, I mean, there's a variety. And I think that we offer a lot of tuition assistance. We offer a lot of certification pay. So if I'm someone who's working in the hospital or in the healthcare organization as an entry-level staff member who is going to school for their RN, or who is even going to school for, let's just say, accounting, I'm able to use that tuition assistance to help me pay for the education that I need to progress to that next salary, grouping, that next salary area that I'm looking to be within.
You find that pretty common? Is that a goal for a lot of people that come in entry level?
I think it is. I think most people, take a position because it's a position that can be flexible. We offer those per diem hours. So it's flexible while they're in school. If they need to be in school full time, they take advantage of the tuition assistance and help them pay for their education, and then kind of move themselves and promote themselves into those other positions. Obviously, for us, someone who's acquainted with the organization, who we know holds the same values as the organization, who is a good employee, and we can already identify that in them, regardless of what position they're in to start, is always a more likely, a more successful candidate than someone kind of from the outside who's an unknown. So we do look at our employees first.
Okay.
And so it's always good to have that opportunity and that background. And healthcare really is a different animal. It's really difficult to come from a more corporate environment and step into a healthcare environment as a non-clinician than it is to kind of start there and understand the inner workings and how the company as a whole functions business-wise and move into those types of positions.
So our younger people who are just starting out, they might want to start looking at this realm early.
Yeah, definitely. And we try to provide them with some career counseling as we go. So we try and identify those people that are in school, that are in an entry-level type position, and that are accepting tuition assistance, and try and help them move at the appropriate spaces and time, so that we're not in a position where, we need to take 2 steps back to take 2 steps forward, but rather we can kind of grow with the position, and the income can grow accordingly as well.
Sure. Okay.
And we do have some of our students working at Inspira and other hospitals in the area. So it's to the students' benefit, but it's also to the clinical agency's benefit as well, because many of our students do go on and stay in that facility. So it works for both.
It absolutely does. We benefit from that completely. Again, just like Teresa said, it's that whole kind of knowing who the employee is, knowing that they're a match, and knowing that you can kind of help them progress to where they need to be and where you would like them to be, in the end, staying with you.
Mm-hmm. And we have many non-traditional students, so moms or dads that have children at home, so they need to stay close at home, but they still have to work. So the community college and them working at the local hospital is a very good solution for them.
So I'm going to ask you, it kind of fits the theme, but I just want to ask you one last kind of wrap-up question. If you could suggest to someone going into the medical fields, outside of their program-specific coursework, one class that they should take that would help them, what would it be? And one skill that they could develop that would help them get into or move forward in their careers in your fields. Sorry, I threw that one out of left field a little bit, but
you did.
Yeah.
Teresa, do you want to go first, or do you want me to?
I'm going to say public speaking. Communication is so important in any arena, and especially in the healthcare arena, with patients, with your superiors, with your peers. So I would say public speaks, but something with communication, and public speaking would be a good place to start, I think. You have to be assertive, and I think that would help. Public speaking would help with that skill.
Yeah, I agree. Communication is key. I was going to say emotional intelligence. Just because I think that, people knowing how to deal with people is really important, no matter what your business is, no matter what position you're in. Your internal coworkers are your customers. The people coming in are your customers. And so you really need to know how to relate to people, how to get to know people, how to meet them where they are, and really help them see what benefits there are in whatever the services that you're providing to them. And I think sometimes in a time of, technology and And it's difficult. Those face-to-face interactions need a little bit of help sometimes, I think. And so that's a good way to get that.
Yep.
Well, see, I'm putting a shout out there because in my previous life, I taught college classes in communication. And I know that our programs in Colorado, the nursing programs actually required an interpersonal communication course. So
Yeah.
that was really cool. Obstacles, drug testing. Is it a thing where if you're employing people?
Yes. As a nursing student, the students have to have a background check and a urine drug screen in order to stay in the program. I believe that's a requirement of all healthcare agencies, correct, Nicole?
It is. Yep.
Yep.
And some have different requirements. There are different mental health background checks that we do for people working in those services. DMV sometimes, depending on if they're in a position that's going to drive or travel between our locations. Definitely background check, employment verification, and physical screening.
Okay. All right. Anything you want to add? We're about to the end of our time, but is there anything I missed that you would like to add, either of you?
I would encourage people to, even if they have even a little thought that they would like healthcare or nursing, go try to find a job in a hospital or a healthcare facility just to see if that's really what they would like. And you start out little and there's no telling where you can go. There's so much you can do in healthcare. So just get your foot in the door and test out the waters, let's say.
I agree. I agree with Teresa. As somebody who, when you're graduating sometimes and you're beginning your career, you're not really sure where you want to go. And healthcare, at least for me, when I graduated, was not one of the choices that I was going to make, and kind of ended up here accidentally, and found how much I loved it and how rewarding it was and how beneficial I thought it was. So I agree. Definitely look into it, see where you fit into their landscape. See what opportunities can be afforded to you, and take a look around. You might end up finding that you actually enjoy healthcare and enjoy being part of that, even if you're not a clinician.
Right. And there's so many things you can do in healthcare. You have physical therapy, occupational therapies. You have PTA, which is a physical therapy aide. So perhaps you don't want to do the 5-year commitment, but you could be a physical therapy aide. But by being in the healthcare facility and observing the different positions that are available, it might help you decide. And there's so much in healthcare, not just in hospitals, acute care settings. Like I said before, there's assisted living, long-term facilities, outpatient. There's so much opportunity. So it's a good first step to get into a facility and see what's out there.
Awesome. Well, thank both of you for your time today. This was a good conversation. I enjoyed hearing your stories, hearing the opportunities, and just getting to know you a little bit better. Hopefully we can do this again in the future, and through this we can start to help some of our Salem County residents start moving toward those careers in healthcare. So again, thanks for your time, and we will call it a day at that point. Take care.